Alright, so today I'm going to be talking about a case of basilar artery occlusion and thrombectomy. This is a 60-year-old patient who presented about an hour after becoming weak and nauseated while performing yard work. He was found to have some drowsiness on initial examination, the ED, but a code stroke was called given the concerns. And here's the non-contrast CT. Here's an old infarct in the right occipital lobe and what looks like probably old infarcts in the right basal ganglia. Really not much else to talk about. And then on the CTA, there is occlusion of the proximal left vertebral artery. You can see my arrow is hovering over it. Segmental occlusion, reconstitution in the mid aspect of the V2 segment, and then patent intracranially. Basilar artery, there's a short segment occlusion distally. The apex is patent. Left P1 looks okay, right P1 looks small. Tough to tell exactly what's going on there. But given his low stroke scale of 1, he wasn't a candidate for thrombectomy at that time, just close monitoring. Tenecteplase was considered, but again, low stroke scale was thought Tenecteplase was considered, but he had a history of intracranial hemorrhage and so was not given, also had the low stroke scale. His disposition was admission to the neurocritical care unit. While they prepared a bed, he was going to stay in the emergency room, watch closely. About 2 hours after his initial presentation, he was found to be unresponsive, not moving any extremities, actually lost his corneal reflexes. So I was contacted again and told them to bring him to the angiosuite. He was intubated before that and then brought. Here's a run of the left subclavian artery. You can see occlusion of the left vertebral artery proximally, kind of a steeple morphology, so maybe a dissection. I presumed it was atherosclerotic in origin, the occlusions in the left vertebral artery, but maybe it was a dissection. Anyway, the Barrison catheter was advanced into the distal V2 segment and injection was performed, showing that he now has occlusion of the left vertebral artery kind of near the dural penetration, and basilar artery doesn't fill also. So that clot that was in the left vertebral artery embolized. That was the cause for his sudden decline. So here's an injection of the microcatheter within the basilar artery. You can see filling defect in left P1 segment, basilar artery, left vertebral artery, pretty extensive. Here's a stent retriever deployed across the clot and injection showing that there is still some stasis of flow at the proximal aspect of the occlusion, but actually pops open in a delayed fashion and penetrates into the left posterior cerebral territory. This was a 4 by 40 millimeter stent retriever device used. And here is the post-retrieval run showing that all the clot is removed from the basilar artery P1 and left vertebral artery. You can see here there's a capillary phase defect in the left pica distribution, maybe in the left superior cerebral artery distribution. And just to show you the clot that was removed, here it is, 4 centimeter clot in a single fragment retrieved on a single run, which was great. So just to show for completeness sake, here's injection of left vertebral artery showing that it's patent here. Here's the left subclavian artery after the procedure. You can see that there's some narrowing of the proximal left vertebral artery, so maybe it's a dissection, maybe it was a plaque that ruptured and clotted off. Either way, it's gone now, which is great. So to review current literature on the subject, here is recommendations from the Society of Neurointerventional Surgery, and this reviews a couple recent trials and what the recommendations are for thrombectomy in the posterior circulation. Here is the posterior circulation aspects score rubric. Recommendations state that from 0 to 24 hours it's reasonable to do thrombectomy with an NIH stroke scale score of greater than or equal to 6 or an aspect score of greater or equal to 6 for patients that are 18 to 89 years old. It depends on 0 to 12 hours or 12 to 24 hours, the evidence behind it. But what I like to do with these articles is now do what AI will help with to summarize. So first what we need to do is actually go to this article and upload it. So we'll show it in the library. We'll show the file. And this is Zotero that I'm using for my citation manager. So we'll drag it, drop it into here, let it upload. So let's go ahead and ask, can you create a summary of this article? All right, so here's the Summary here, key findings. So it does focus, the article does focus on these more recent trials, which are Attention and BAOCHE. Gives a good outline of everything that's discussed and the recommendations, but it's still not great to see what the updated recommendations are. There's no stats there. It doesn't really help me, but I found that there is sometimes it can be helpful to look at this information in a more visually pleasing manner. So I've uploaded a visual abstract from the New England Journal of Medicine about one of their research articles published in, I'm sure it was 2021, sorry, kind of summarizing an article. So we'll see if we can get it in that form. Can you summarize the recommendations from the basilar artery occlusion paper using the format in the attached picture, question mark? Yeah, it does. Okay, see, look at this, still including this. You are still including information from the COVID trial period. I only want information from the basilar artery occlusion paper period. Also, could you make it more visually pleasing? All right. And you don't always have to fix transcription errors. It will detect when something is incorrect and automatically update a typo or transcription error, which is pretty nice. All right, let's just see here. What? Let's try this again. Okay, can you just start over with a new table presenting the results from the basilar artery occlusion paper? Let's see how it does, because here it transcribed it as the basilar artery. Let's see here. See, knew that I actually wanted basilar artery occlusion, not bachelor, so pretty good. I can already tell this is bringing up some COVID information. See how it does. Unsupported libraries. Okay, let's see what it says. I'm getting an error that unsupported libraries or icons are detected. Period. Can you fix this? Question mark. See how it does now. Okay, that's a little bit better. Time window 0 to 12, EVT indicated, EVT reasonable. Here's the class of evidence, the evidence level, which is great. Class B from a randomized trial. Good. All right, let's just add a couple other things here. Can you add the citation for the article in this table? Question mark. Also, can you add any statistical information for the recommendations? Question mark. I'm getting an error that there's an unexpected token, comma, a semicolon. All right, let's see if it does it now. Okay, a little bit better here. Okay, easy to great, read, but better. Here's the stats back up. So the recommendations, RCVT indicated, doesn't provide the information on the that are candidates for thrombectomy. Let's go ahead and add that. This doesn't have any information on patients that are candidates for thrombectomy based on the aspects score or NIHSS. Can you add this information? Let's try doing it without any correct grammar. See how it works. Yeah, it's a little bit tough to read, but the information is there. So not bad. Again, 0 to 12 hours, here's the aspect score and the stroke scale. 12 to 24 hours, reasonable, endovascular therapy, reasonable, and then the case-by-case basis. All right. Okay, so let me try one more thing. Let's go ahead and start a new chat. And I didn't prompt chat at Claude at all for that chat. So let's start prompt and see if that's better. Let's see here. You are a research assistant, period. I am a physician and scientist interested in clinical trial results and recommendations from the scientific literature, period. In particular, I'm interested in neurointerventional or neuroendovascular research, period. I will upload some papers and I would like you to summarize the papers here. In particular, I would like you to summarize the papers using visually pleasing table or abstract, period. I am attaching an example of an abstract that I think should be replicated when you summarize any paper I submit, period. Let's go ahead and add this now. All right, so let's go ahead and do that. And again, so anyways, go. Okay, so I create some. Okay, so let's go ahead. Let's get rid of this. Let's go ahead and get our paper again. My library. Let's see here. Show file, and then we'll pull it into here. Upload it. Okay. Right here is a paper that I've attached that I'd like you to summarize, as discussed. All right.
Clean.
Yeah, clean.
Yes. legalize it.
Good. I'm right in the middle of something. I'll come and get you in a second, okay? So here it is. It's a little bit wordy, but let's just see if I can make this a little bit better. Let's go say, okay, let's see here. Do trial evidence, imaging considerations, updated recommendations. Okay, there's a table here. All right, well, that summary is good, but a little bit wordy, and it's not in a format like the picture that I attached originally to this chat period. Can you create a summary picture with the major results from this recommendation paper? In particular, can you make sure to include the updated recommendations, considerations for inclusion for thrombectomy, and any important statistical information for the recommendations? All right, so look at this. There's some, a little bit worried. Okay, so let's see how it does. Okay, all right, update guidance from SNS 2024. That's good. Study population, patients with acute basilar, okay. Inclusion criteria, updated recommendations, 0 to 12 indicated, 0 to 24 reasonable. Okay, by case, age. Here's the trial results. All right, so this isn't too bad. Gives the updated recommendations here. Are pretty good. All right, so not great, but it's, to actually be a little bit better. All right, well, there we go. So that is just a case of basilar artery occlusion with success thrombectomy and a good clinical outcome, and a little bit of AI magic. It worked okay, actually, but tested out before. It's worked a little bit better, but in this case, providing the prompt maybe helped it be a little bit better, particularly with the initial summary, but still need a little bit of coaxing in order to get it was more visually appealing. All right, well, thank you very much for watching.